Good afternoon, everyone. Welcome to today's webinar, Addressing Behaviors in Children with Autism. My name is Chad Severs, and I'm really excited to have our speaker, Lauren Quetch, here today. It's a really popular topic, and we got lots of folks on, so excited about that. So I'm just going to go over a couple of housekeeping announcements, and I'll introduce our speaker here. But before I do housekeeping, again, my name is Chad Severs. I'm the program manager for Arkansas Building Effective Services for Trauma, or ARBEST. And we are a state-funded program at the UAMS Psychiatric Research Institute. And our aim is to improve mental health services for children who have experienced trauma from events such as abuse, natural disasters, or family separation. We work really closely with child advocacy centers and other providers in the state to build trauma-informed mental health system. I'm probably best known for providing training to mental health professionals and treatments that are effective in helping children recover from trauma. So that's just a little bit about us. We really encourage you all today to ask questions during the presentation. So just use that question feature, which is on the right side of your screen. If you have a case-specific question, we ask that you just you can type those in, but we probably won't address a case-specific question over the webinar. We can try to handle those offline. If you're interested in earning a CEU, just be sure to stick around to the very end. We have a code that's given, and I'll have some more instructions about that at the very end. We are recording this webinar, and we'll upload this presentation to our YouTube channel. And if this topic or other training notifications interest you, be sure to like us on Facebook. We frequently post about upcoming events there. We also have a newsletter and some other cool stuff, so be sure to check us out. So let me introduce our speaker. Lauren Quetch is a clinical psychology doctoral intern at the University of Arkansas for Medical Sciences. Upon the completion of her internship here, Lauren will actually start as an assistant professor at the University of Arkansas in Fayetteville in the Department of Psychological Science. So we're really excited that we actually get to keep Lauren here in the state of Arkansas. Lauren's clinical and research interests are in the areas of children with disruptive behavior concerns, and she's a certified level 1 trainer in parent-child interaction therapy, or PCIT. So I think some of you on today's webinar are going through that training or have been to that training before. So please give a warm virtual welcome to Lauren.
Thank you, Chad. I really appreciate the introduction. I'm excited to talk with everyone today and let you know a little bit about serving clients with autism. So, yeah, I think this is working. There we go. So today, this is just a little bit of an overview about what we're going to be talking about. So I'm going to go over the definition of autism and really kind of highlight the common concerns that often come up when working with kids and families on the autism spectrum. And then talking about what are some of these important behaviors to consider and how these might significantly impact treatment that you're providing to families while you're thinking about sort of the overall family and not just necessarily certain behaviors that they're coming in for treatment. So we'll talk a little bit more in detail about some of those behaviors later, as well as how do we think about behaviors. So this functional analysis is really helping us think critically about what does the behavior mean and how can that impact treatment, and understanding what we need to be thinking about as we're trying to provide treatment. And then I'll make sure, I know I've got a slide at the end for questions, but I'll try to make sure to answer questions as we go along through this entire presentation. And I've got some contact information for myself too if you want to contact me after. So we're going to go ahead and start with the definition. So what is autism spectrum disorder? Well, it's a neurodevelopmental condition, and it has specific deficits in a number of areas. So the first one is social communication and social interaction. So how are we communicating? How is the child communicating with others? How are they able to interact? And oftentimes these children are going to struggle in a number of areas related to this. And then the other really important part then, in order to be diagnosed with autism, is having a restricted or repetitive behavior patterns. And so I'm going to talk a little bit more about these And what exactly does that mean? So this is the definition, but what does it really look like when you're working with these families and these clients? So just recently, the Centers for Disease Control released the most updated numbers about how many children in the U.S. are diagnosed with autism, and the number is now 1 in 59. So I believe about 5 years ago or so, I think it was 1 in 68. So the number is actually decreasing, which means more children are being diagnosed with autism. So now we're going to talk about what does social communication deficits look like. So what exactly does that mean if a child is presenting with autism? What is social communication? What does it mean? So one of the first things is the failure to initiate or reciprocate emotional and social exchanges. So some examples of this. There we go. So that is, some examples might be, a friend comes up to a child with autism and says, man, I did the coolest thing this weekend. I went swimming, and then I went to a birthday party. It was so much fun. And then the child responds by talking about how unrelated, my dog has a black spot on the back of its back, and I don't really like that. I wish my dog didn't have that. So the idea is not really able to understand how to reciprocate that relationship, how to talk about something that the other child is talking about. So it would seem odd and sort of take other kids, they might be saying, well, what's going on here? I don't understand what's happening. It makes me feel a little off. Another one is a failure to imitate facial expressions. So we even look for this in little kids diagnosed with autism. Are they smiling back? So if you smile at them, if they're talking to you and you have a social smile at them, are they going to reciprocate that? Are they going to smile back? So that's another thing to look for. Also, they might have difficulty with the ability to imitate skills. So when you have a little kid especially, if you, oftentimes parents will try to teach their kids how to do things, or little babies, for example, it's like you try to teach them sign language so you can understand what they're saying or what they want before they can speak. Is that child able to do that? Are they able to copy those behaviors of the caregiver? Do they understand how to do those sort of social exchanges that way? So those are just a few examples. So for abnormal and nonverbal communication, behavior, and understanding, a lot of times when people think of children with autism or think of people with autism, they think of eye contact. So is this child doing a very good job of looking at the other person? Do they understand when you speak to someone, is there eye contact? Like, what is the appropriate amount of eye contact? So that might be an example, is they're not really looking at the other person when they're speaking to them. Another one may be that individuals with autism don't necessarily have the inflection that you would expect when you are speaking. So if I'm telling a really cool story, I might say, oh, wow, it was really awesome, and we did that. Man, it was too bad that this happened. So the idea is that intonation of voice goes up and down. It kind of fluctuates depending on what you're talking about, and you might not quite get that same intonation or tone with individuals with autism. It can also be that some of the facial expressions, they might not be expressing a lot of different emotions in their face. They might not understand how to. They might not be able to project how they're feeling on their face as well. Another one that is often looked for or commonly talked about is if the child gestures. So having that integration between describing and speaking while you're also gesturing. For those of you that are familiar with some of the different assessments that look for whether or not someone has autism, they might ask a child to describe a common activity that they do, like brushing their teeth. And is that child able to talk about brushing their teeth at the same time that they are actually gesturing to show what does it look like to how to brush your teeth? And then another one in this area might also be the lack of joint attention. So having difficulties with this. So for example, if you're having a conversation or a child really wants the parent to look at something, ooh, they just saw a dog over there. And so they look at the dog, then they look at their parent, and they look back at the dog. So the idea is, hey, parent, I want you to see this really cool thing. Let me make eye contact with you. Let me look at you to show you where I'm looking so you can enjoy this with me. So children with autism oftentimes have issues with that as well. And so the last one then with social communication is that some of these kids have difficulties with forming and sustaining relationships. So a lot of times these kids might play alone, and that might be that other kids just don't understand them, or they don't, or maybe these kids don't know how to go and make friends. They sort of have that disconnect there. And sometimes these kids really don't like to be touched. That's another thing too to think about. So those are some of the deficits. Now, in the area of restricted and repetitive behaviors, one of the first things that you might look for is a stereotyped or repetitive movement or speech. So examples of this include children might flap their hands. That's commonly what you see in young children with autism, especially those that are more severe level of autism. And then like the picture that I have up there, kids might not really have much creative play, so things they might find fun include just lining up toys in a row, organizing things by color. So it's more structured and less creative in that way. The next one here is rigidity and routine. So having a lot of transitions or things, if you have a routine and then all of a sudden as a parent you have to make a stop along the way that wasn't part of the routine on the typical route on your way home, this might end up with a child becoming very dysregulated and throwing a tantrum. It might also be that every window that they pass by, they have to look into it. So it's sort of like, this is something I have to do, and I can't break it. This is something that is part of my routine. The other one is abnormalities in domain or intensities of interest. So they might be very, very interested in one thing, and that is what they talk about. So every time you talk to them, they don't really like to engage with someone else in their interests or talk about something that isn't of interest to them. They just want to tell you about that one thing that they really, really like. Another thing that also is common is instead of sort of looking at something in its entirety, they might become very fascinated by something small. So if you've got a toy car like in the picture, rather than looking at the whole car and thinking the whole car is really cool and playing with that, they might just look at a tiny piece of it, just look at the wheel and spin it over and over again. And again, this is not the case with all kids with autism. These are just some examples to give you a sense of what these different things mean. And then the last one here is abnormalities in reactivity to sensory input. So oftentimes families that have kids with autism will mention, oh my goodness, I can't go to Target. There's just too many noises. My kid loses their mind. Or bright lights really are bad for my kid. I even talked to a family the other day that said, I've just learned that if I keep the lights in the house lower, that everyone does better. So my kid, the parents have adapted, and the kid is essentially behaving better and able to handle things better because there's not as bright of lights in the home. And then the opposite of that, right? So the extreme of that is, so some kids are very sensitive to those things, and other kids will not make a reaction at all. So there might be a big clap of thunder, and they don't react at all. They might just not even they don't have the response that you would expect of a kid if something big kind of scares them. Okay, so that was the definition and sort of the common things that go along with children with autism. And so now I want to talk to you a little bit about additional deficits that often co-occur when children have autism. So the first one here is cognitive impairment. So if you are thinking about cognitive impairments, I really want you to think about executive functioning. This is their ability to take in information, manipulate information, make decisions. So again, like I mentioned before, maybe instead of looking at the larger car, they're spinning that wheel. Another thing, kids with autism might really focus on details of things instead of looking at the larger picture. So they become very focused on something small. They have a hard time processing large amounts of information, being flexible, so that really goes into the line of, I like my routine, this is what I do, and when I have to change that, they don't handle it well. And then also, learning and processing speed really is how quickly are they taking information, how can they really understand that information in order to use it and react to the world around them. The next one is linguistic impairment. Excuse me. So this might be when how well can a child express themselves or interpret the information that you're telling them. So oftentimes you'll see with kids, parents will say, well, my child really didn't start speaking until they were 2. So there's a delay there. When most children start speaking their first words at 1, these kids sometimes parents almost talk about it as a regression. So they really were developing what they thought was appropriately, and then they kind of stopped, or they didn't say much more anymore. So something else to look at is a young child might, or even an older child might not respond to the sound of their name. So if you just say, Johnny, 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 they might not respond. Another thing is they might speak at an inappropriate volume and not understand how loud they're talking, or they might not understand, like we talked about earlier with when you're telling a story, you go up in tone, you go down in tone. They might not understand other people's intonation. So if you tell, if you are being sarcastic, so you say, oh, that was really fun, they might not understand that because they really don't get sarcasm. They don't get that the tone of voice isn't literal. So and so they might think, oh, that was really fun, when instead you're meaning it sarcastically based on the tone of voice that you've used. And the last one that I want to talk about here too was adaptive living deficit. So sometimes kids have motor delays, which can prevent them from being able to do things that same-age peers are able to do. And they also might be below what you'd expect them to be based on their cognitive abilities. So if they are, their IQ is average, their adaptive living skills might be significantly below that. So there are things that are getting in the way of them being able to do certain things that you would expect for children their age. Okay, so now I wanted to go on to some of those common concerns that we see with children with autism. So when you think of children with autism, I want you to think about 70% of those kids will have at least one other issue that's going on, one other concern, and then another 40% of those people will have more than 2 things that are going on. So oftentimes you think, okay, I've got a child with autism, they're coming in for, because the parents don't know how to deal with this new diagnosis, but there might be other things that are going on that are also very limiting and impairing for the family. So being very aware of what are some other things that are going on that maybe the family's not even initially expressing. It could be more complicated than it presents originally. So I think I wanted to pose this question and also give some time for anyone that has questions already. But I just wanted you all to think for a second, knowing this information, why might be important to consider this and thinking about comorbid diagnoses when you're working with families of children with autism. Was there anything, Chad, that did anyone have any questions yet? Okay, well, what we'll go ahead and do then is we'll just move on. But Chad, you let me know if there's anyone does have any questions. So let's move on. Okay, so I think if you consider that question that I posed earlier, I think it's important to be aware of that there are a lot of things that are going on with families. So not just taking what they say originally as fact. And oftentimes these families have adjusted. They have accommodated their lives and they don't realize it. So that family I was talking to that mentioned that their lights are kept low for their child, that's just sort of normal now for them. They don't even think of that as being an accommodation anymore. That's just how life is. So I want you to be very thoughtful when working with families of children with autism to think about what might be something that they are having to do in order to prevent those tantrums and those different things that are going on with the child that they might not originally even tell you about. So first things that I want you to consider, and we're going to go through each of these individually, is psychological concerns. So we're going to talk about anxiety, disruptive behavior problems, as well as ADHD. And then other problems also include that children with autism often include genetic disorders, motor movement problems, feeding or gastrointestinal issues, epilepsy, as well as sleep problems. So psychological concerns, let's start there. Anxiety. So approximately 42% to 79%, that's a wide spread, but there's a variety. You might have 50% of people, you might have 80% of children with autism also have some level of anxiety. So common ones include specific phobias. So this is, they're really afraid of one thing and it's limiting their capacity to do much related to that one thing. Maybe they're really afraid of a toilet. They just do not want to be near a toilet. Maybe it's dogs, maybe it's something else. So being very aware of, are they really afraid of one thing? And then also social anxiety. So this is a little bit less of a population, but it's still significant. So up to a third, almost a third of children with autism will have some level of social anxiety. So children with autism have emotional regulation issues oftentimes, as well as issues with communicating with others, right? So then we have to be careful to think about how do we differentiate between autism and when anxiety is also present. So just because a child doesn't interact with other children very well doesn't mean that they have social anxiety. It could just be that they have a really difficult time connecting with others, or they really like to play by themselves. So it might not really be an anxiety. It might just be the deficits associated with autism. So being very careful to differentiate. Does this an additional diagnosis? Is it warranted? Okay. And the tricky thing is, as I'm sure those of you know that work with kids and have to deal with anxiety, it can be oftentimes difficult for caregivers to even understand that the child is experiencing anxiety. So if they're not communicating it well, just because it's an internal experience, they might not be reporting it at the level that the child is experiencing it. So being very thoughtful about that and really trying to assess the child and speak with them as best as they can report that. And sometimes when you work with kids with autism, if they do have an anxiety, their anxiety might be related to mechanical objects. So that example that I gave earlier with toilets. So just having a phobia of something mechanical, or the weather. So they don't want to go outside on certain days. So if it's cloudy, they really don't want to go outside. And thinking about how this can really be impairing for a family, in addition to whatever else is going on with the child that brings them to treatment. So now I want to talk about disruptive behaviors. So this can happen between, in children with autism, from a quarter to a half of children. So it's interesting to note too that in the population of offenders, so individuals that are harming or potentially in like the justice system, the juvenile justice system, there's a higher percentage of individuals with autism than there are in the general population. So that does not mean that individuals with autism are more likely to offend. It just means that there is a higher rate in offenders of individuals with autism. So, common concerns related, common things related to disruptive behaviors can be self-injurious behavior. This can be very stressful for a family. They're concerned about their child's safety and well-being, and the child is doing it to themselves. So things like head banging, it might be that the child is in pain. It might be that they're trying to communicate and no one understands them. They get really frustrated. It might be attention seeking, or it might be, I am so overwhelmed and overstimulated right now, and I don't know how to handle my emotions. I'm just hurting myself because I'm not able to cope. So things like head banging, biting, scratching to themselves, it can be very scary for the child, like they don't know what they're doing. It's harmful to the child, and it can be very scary for a family too. And then also behavior that is potentially harming others. So maybe they're throwing tantrums, or they're kicking, or they're hitting. They might be biting others. So really being thoughtful about what is that disruptive behavior? What is the purpose, and why is that disruptive behavior occurring as well? And we'll talk a little bit more about some of these things later and what to consider. Another one is ADHD. That is a common disorder that co-occurs with autism. So up to 80% of children with autism also have ADHD. And given that it's a neurological, autism is a neurological disorder, just parts of the brain that are associated with autism can also be linked with attention deficit and disorder. And so these things, again, being very thoughtful about when or if it is necessary to diagnose that additional disorder. So really thinking about, if that child has autism, is there enough information to warrant an additional diagnosis? So inattention, hyperactivity, impulsivity, that is not at the same level or is developmentally inappropriate for that child's level of functioning with autism. So being very thoughtful about, is this going above and beyond just their symptoms of autism, that it warrants an additional diagnosis. Okay, so now I wanted to move on to developmental and physical concerns. And I guess before I move on, was there any other questions that anyone had that they wanted me to answer? Okay, so we'll go ahead and move on. And if you guys do have any questions, I'll make sure I leave some more time for you to ask them. So the next part is genetic disorders. Now, I'm going to tell you that I do not have full expertise on all the genetic disorders, but I do have a list. So just be aware that some children with autism also have additional genetic disorders, and to be mindful of that and really do your research to understand, what does that mean? What are the limiting factors related to these additional disorders? So they're at higher risk of these genetic disorders, and hold on. There we go. And these are some of the co-occurring disorders that happen. So again, I am not an expert in any genetic disorder. However, just being very thoughtful of these are common things that occur with children with autism, and what does this mean for the family if they've been diagnosed with this? What does this look like? What are the impairments associated with these different genetic disorders? And really understanding whether it's a lower IQ with some of them, whether it's mobility, whether it is seizures, which are related to some of these things, just being very aware of what does it mean and what does it look like, and what are the deficits for the child and for the family. So the next one I'm going to talk about is motor movement. Some motor impairments of children with autism include difficulty with their ability to do certain motor tasks. They might have lower muscle tone. So children with autism sometimes are more flexible than your average kid. They might have certain movements that are really hard for them. to do what are sort of necessary in a classroom. Like some of them might have a really hard time using scissors and cutting with those, just because it's hard for them to grip the scissors and manipulate it in the way that they want it to. Another issue might be that they drool, or they have a hard time controlling that. Another concern oftentimes that you might see with children with autism is they might walk on their toes more. So just being aware of certain tasks might be more difficult for these kids, which might be why they are limited in some of their adaptive skills as well. Things they can do at home, things they can do at school. And so it might prevent them from completing certain tasks. Writing might be particularly difficult. Their hand might fatigue faster than another child. And maybe it's really hard to participate in some recreational activities just because of some of those motor impairments that they have. Okay, the next one that we're going to talk about is feeding and gastrointestinal concerns. So children with autism are 5 times more likely to have feeding problems, and oftentimes you'll hear these families talk about they do not eat anything except peanut butter and jelly. They don't eat anything except hot dogs. So, and it's not getting them the nutritional value that they need, and whether it's related to textures, whether it's related to the issues that they have in their intestines, but being really thoughtful too of how that can impact a family and a child. So they might strongly prefer things like starches, packed foods, and they're not really getting what they need to in their diet, like adequate amount of fruits and vegetables. Again, like I mentioned, the textures of food might be a problem. So certain things that are slimy, certain things that are too rough for them, they might be unwilling to try it or eat it. Another thing that might happen is that if you don't want to eat your food and people are trying to make you eat your food, you might become disruptive at mealtime. So thinking about how this can be an adaptive behavior for them, if they don't want to eat and they don't want to have to eat the foods that people are presenting to them, they might get a little bit disruptive and they might not want to sit down or listen to what their parents have to say. Gastrointestinal problems are important to think about. So sometimes these children have issues with constipation. And when they have issues with constipation, that can create significant discomfort for these children, which then can lead to issues with toileting, which then can lead to issues with trying to go places regularly if they are having an issue with toileting. So really being conscientious of what does this mean and what are common things that might occur, and even providing that information for families of children with autism. This is a common thing that happens for these children. Might provide a little bit of relief for families to know it's not just them that are going through it. Again, you might have some rigidity related to gastrointestinal problems. If it hurts, if your stomach hurts, you might not be able to move in the same way, and if it hurts, you might refuse to do things because of the discomfort that you have. Other things are sensory sensitivity, so they just experience things more, they notice things more as they move through their system, and they just might have learned, if I throw a big enough fit, then I don't have to eat. And so, again, what are meal times looking like, or how is that preventing them from being able to eat normally and throughout the day? And what does that look like for families? Because a lot of families are really stressed out by this, making sure their child is gaining an adequate amount of weight. There we go. So another common concern is epilepsy. So a lot of these children have seizures. And by a lot, I mean about a third, but that is a significant portion of children with autism. And there might be fewer than that, but again, studies vary in the rate of these children. So something, again, to keep an eye out for. Are these children having seizures? What does that look like, and how stressful might that be for their family? Because for those of you that are aware of sort of the precautions that go into children with having seizures, you have to do a lot of monitoring. You need a lot of medical assistance. What does it look like? How do you handle it? And how stressful is that to see your child going through that? So not being able to help them in the moment and really thinking about what's the impact for the entire family. There we go. And also understanding that seizures can cause neurological deficits. So if seizures are occurring, they're firing, there's sort of an issue with the firing in the brain. So it can create sort of increased likelihood that the misfiring in the brain is also leading to things like impulsivity, not being able to utilize parts of the brain that are being impacted by the frequency of seizures. Okay. Another common concern that often comes along with children with autism is that there are sleep problems. So that's a big percentage of children with autism have sleep problems. So whether it's difficulty falling asleep, if they're waking up in the middle of the night and staying up for long periods, waking up early, more night terrors, and even anxiety about going to sleep. What does this look like? How is this impacting the child? Because if you're not getting enough sleep as a child, you're more likely to be disruptive. And how does that also impact the parent if they're not getting enough sleep, increasing their stress and their irritability? And like I said, so if a child isn't getting enough sleep, they're more likely to be aggressive because everyone, myself included, if I don't get enough sleep, I'm going to be a little bit crankier in the day. And I already mentioned that, just understanding that this disruption can also disrupt the parent's sleep, and how does that impact them over time, that lack of sleep. Okay, so now I want to talk to you about some important behaviors to really think about when you're working with these families in therapy. Okay, so one of the first things that I want to talk about is the importance of understanding the difference between what we commonly refer to as a tantrum and what children with autism might be having, which is a meltdown. So the first one is a tantrum. The idea is that you are, kicking, screaming, throwing yourself on the ground. You are getting very, very frustrated because maybe the parent has told the child no. So the idea is, if I keep fighting, I am just going to get what I want if I keep fighting. So it's really motivated by that parental attention. If I keep fighting this parent, I'm going to get what I want eventually. So if the parent is giving the child attention, the idea is that that tantrum is going to continue, or that tantrum is going to sort of get bigger and bigger until the parent gives the child what they want. And from what we know about tantrums and disruptive behavior with any kid that has sort of a tantrum, is the idea is, if that is ignored, if that tantrum is ignored, then it will, they'll decrease over time. The intensity and the frequency of those tantrums will decrease over time. The idea here is the child is the one in control of their behavior, and they can adjust that tantrum, that behavior based on the parent's response. They're in control. The parent is either providing them attention or not providing them attention, and therefore the child can manipulate that behavior over time. So whether they get bigger or they get smaller. So thinking about that and the difference between then what a meltdown looks like, the idea is that a meltdown with a child has nothing to do with whether or not the parents are paying them attention. It is if the child is feeling overwhelmed by certain situations, maybe it's too much sensory, it's sort of like a sensory overload. It's an emotional experience for them that they cannot control themselves and cannot regulate. So it might look a lot like a tantrum, and it's not the same. So what's the difference? The idea here is, one is really, I want my parents' attention, I'm going to get what I want, and the other one is, I'm overwhelmed, I can't handle it, And because of my disorder, I don't know how to handle the situation, whether it's too much light, too many senses going on. Sorry, I was just reading a message from Chad. So he said, if you hadn't gotten the message, he said his audio is acting up and he can't seem to unmute himself. So if you have any questions, to send them his way, and then he'll forward it on to me. So that's quite all right, Chad. We understand. These technical difficulties happen. That's important then to distinguish what is the difference between a tantrum and a meltdown, because if you're talking to a parent and you tell them that, well, you think that it's a tantrum, then that isn't going to be the appropriate response for a child who is actually having a meltdown. So really understanding that children may have their behaviors look the same, and it might be motivated by two different things. So having that appropriate response and guiding the parent to have the appropriate response in those different situations. Okay. So the next part here too is that we kind of mentioned already, is that children with autism already have a sensitivity to senses. So it might be a little bit, it might be extreme, but the idea that noise, crowds, bright lights, taste, smell, touch, this might bother a child with autism more than the average person. So this leads to those meltdowns. It leads to aversions of food, right? It leads to, I don't want to go out to these places because it's really painful for me. So thinking about that too, how can this disorder impact the child's behavior? And then understanding too that a child who seems very bright and capable of doing all of these things might not be able to do it. So if it's maybe it's a dark restaurant and not many people around, does great, can sit there, is awesome. And then the next time they go, the lights are a little bit brighter. There's a lot of people there and they might not handle it. They might not be able to handle it. And this can be very difficult for families to understand or even for the child to communicate. And then an important aspect of that too is that if the child is feeling overwhelmed or overstimulated, this can eventually lead to the children running away. So that's elopement. The idea is like the child might run away from the situation to escape it. And that's very concerning for any parent. What do you do when a child runs away? So how does that environment impact the child's behavior? It's important to consider. So this is an important statistic too. Almost 50% of children with autism have the tendency to run away from their parents. So it's whether they're running into the street, running out of the house. There's actually, oftentimes families will talk about the children that run away. They'll have to communicate with their local police department to put a GPS tracking device on their child attached to their ankle so that they know where their child is at all times. So if you have a child that is able to unlock a door and leave the house, they could run out of the house at any time. So how do you help those parents make sure that the child is being safe and being very thoughtful about what's going on in the home and how much stress that can cause? Okay, so now restricted interest. We've talked about this a little bit already, but understanding that children with autism are more likely to have restricted interests and that seem odd or unusual to others. So I just wanted to give you some examples so that you kind of got a sense of what that might look like. Again, the lining up of objects might seem very odd to a parent. They say, how do I play with my kid when all they do is line up objects? Another thing is they might not know how to engage in imaginative play very well. So again, lining up the cars versus maybe pretending the cars are going to a car wash. That might be the difference between some of these kids, and understanding and helping the parents understand how to start engaging with the kids just at the very beginning by trying to do some of the same things that the child with autism is doing, and then eventually trying to get the child to be a little bit more flexible over time. Understanding you have to connect with that child with their interests at first before you can build that positive relationship. Another thing might be they really like airplanes. I've had a child before that was really interested in clocks. So trying to figure out how do you get clocks into playtime. How do you play with clocks? So being kind of creative with that over time too, so that you can engage with the child and have a positive relationship, and then understanding that trying to teach the child to be a little bit more flexible over time might be important. Yeah, and then I mentioned that already. So next thing here. Also important things to think about, areas of weakness for these kids. They really have a hard time identifying their own feelings and the feelings of others. So it might take a lot of coaching on the parent's part, and if you are trying to help them understand how to react when you're mad. It's going to be really hard to understand how to react when you're mad if you don't understand that you're mad. So really helping them get to the point of what is a feeling, or feelings can be complex, or understanding that just because someone's laughing doesn't mean that they're happy. So someone can be laughing when they're really sad or angry, and they wouldn't understand that. It doesn't make sense because you laugh when you're happy. So really helping them understand what are feelings and the subtleties of different feelings too. Another issue that they have oftentimes is, again, that eye contact. So this can be really discouraging for families if a child isn't able to connect with their parent very well, and the parent doesn't feel like the child is connecting, just because some of the common things that we look for with our children, they're not doing. They're not making the eye contact, or they're not looking for hugs, or maybe they don't know how to play with their parents or show that same level of affection originally when maybe they first come into treatment. Another thing is being flexible. So children that have autism have a very hard time with transitions. So you think about the amount of transitions that they have to go through in order to even get into your waiting room. They have to maybe leave school, get into the car. Maybe they get a snack first, and now they're in the waiting room, and now they have to go to your office, or maybe you talk with the parent first, and then they switch, and now you're speaking with them. That's a lot of transitions, and oftentimes kids with autism don't do very well. So thinking about what are ways that you can really work with families to reduce the number of transitions, to increase the likelihood that the child will be able to come to treatment and be able to absorb what you're saying and not have a meltdown. And really thinking about creating a routine, making it standard each time so the child comes to know what to expect as well, and can then adapt to the new routine. Okay, so I think it's really important as you work with these families to really understand what is the child capable of doing as well as the family. So if the family is dealing with 20 of these different issues, what is going to be manageable if you give them something else to try? Or what's the biggest thing that the family's struggling with right now, and can you tackle that first? So even though it seems like for you, I think that this behavior is the biggest thing the family needs to worry about. If the family is saying that's not it, they might already be stressed out enough, and being able to understand we need to meet the needs of this family so that we keep them engaged in treatment, because a lot of these families are stressed out and continue to be stressed out over time. It's important also to think about if you have your standard like evidence-based treatments or manuals that you use to address behaviors, or for children with trauma, for example, if you say, okay, I'm going to do the standard protocol, you might really need to consider or talk with a colleague or a supervisor about what might be some things we have to adapt based on this particular child, their developmental capabilities, or what are really what can they do, and not asking too much, because you want the child to be successful, and you need to understand too then what are they able to do versus maybe what are they just not comfortable with doing originally. And like I said, it's really, really helpful because I love this. People that I've worked with that also work with children with autism, they say when you work with one child with autism, you work with one child with autism. So they all present, each child presents with a unique strengths and unique weaknesses. So really thinking about how do I problem solve and how do I address some of these unique things that are going on. Okay. So one of the last things that I wanted to talk to you guys about was what I call functional analysis. And really the idea of a functional analysis is understanding, helping you better understand, as well as the family, giving the parent skills to understand why a behavior happened and why does it continue to happen. If we don't have the right understanding of a behavior, we're going to address it maybe in the wrong way, and that isn't going to solve the problem. So when I say functional analysis, we sometimes call them ABCs. So the A is what we call the antecedent. And an antecedent just means what happened before the behavior. Were there any vulnerabilities of the child? What was the situation? What was going on that essentially led to the behavior? So B is behavior. What behavior occurred and what did it look like? Being very specific about what exactly did the child do in that moment. And then the C is the consequence. So after that behavior occurred, what happened? How did the parents respond? What did the child do? So why is this behavior still occurring? What might be reinforcing this behavior? So if, for example, a child is screaming in Walmart in the aisle, and they are screaming for a candy bar, and the parent says no, so the child gets louder, and the parent says no, and the child gets louder, and the parent is so embarrassed at this point, they give in and they give the child a candy bar. The child has now learned that if I scream loud enough, I'm going to get what I want. So that's the idea here. What's the consequence? The parent, even though they are like, no more, I can't handle this, they have reinforced that child's behavior, and that child is more likely to do that behavior in the future. So really thinking about what came before that behavior, what set up the situation, what behavior happened, and then what was that consequence are going to be really important to understand what a behavior is and why it's happening. So this is an example that I wanted to give. So if we have a child that the parents are like, my child screams and I don't know how to handle it and it is just driving me nuts. If we interpret it as a tantrum, so they are being defiant. You've told them no, and they're screaming, and therefore it's an issue with them wanting to get their way. We're going to tell the parent then, just ignore it. It's going to get a little bit louder, just ignore it, and it'll go away. Well, maybe that's one interpretation, but again, for a child with autism, maybe they're having a sensory overload. So telling the parent to ignore the child when the child is having a sensory overload isn't going to make that screaming go away and isn't going to help that child regulate. So instead of disciplining or ignoring that child, if we understand that it's actually a sensory overload, the correct response might be take the child away from the situation, go to a dark place, hug them really tightly. Children with autism oftentimes respond to this, rock them. So rock or hug, it might be just involve like a very strong touch that way, and then the child is able to regulate. But understanding, right, that our interpretation, so our what we understand the function of that behavior is, if we're not right, our recommendation for how the parent should handle it could be inaccurate and actually not eliminate that behavior the way we want it to. Okay, so like I said, it's important to understand this behavior of a child with autism and understand what caused it, what the behavior is, and then help us then understand what the solution or the treatment might be so that we are effective. And then, there we go. So that is pretty much it for my presentation. I just wanted to see if anyone had any questions, and then I wanted to just give you the last slide too. So if you did end up having questions later on, that you could contact me if you wanted to. There's one more, slide, Chad, too, that if you want to get to it so that there we go. That's just my email if anyone has any questions. But is there anyone that that does have questions about any of that we talked about? Ooh, let's see. I did see something. Hold on. Okay, so someone said, I'm of the understanding that autism isn't usually diagnosed before age 3. Are the medical issues associated, like constipation, seizures, misdiagnosis? Are things like that joint attention that I talked about. So looking at a caregiver, looking at an object, looking at the caregiver again, those things are as evident as young as a year old. And some of those other things that I've talked about as well are prevalent very early on. So I'm not sure how often it is presented, but it is very likely that some of these things might be misdiagnosed when the child is young and they haven't been diagnosed. And unfortunately, when you work in rural areas, there might not be people that understand autism or even are aware of what it looks like or have the credentials to diagnose it. So you might get a child or even an adolescent that has gone their whole life without being diagnosed. So as a clinician, it's difficult to keep all these things in the back of your head, and it's also important to think about if there is those combinations of different symptoms, being really thoughtful about what it might look like, or maybe there is something else going on like autism. Okay, let's see. So, oh yeah, so someone else had a question. Is there a good way to redirect children or adults with autism? That's a good question. So I guess it depends on the function, like I was talking about, of that behavior. So if an adult with autism might be more aware that they have issues speaking with others, so even having a conversation with them saying, you know, I notice sometimes when we're talking that you get off on tangents, or you're talking about something that's unrelated. So I'm just going to go ahead and interrupt you sometimes when just to make sure that we stay on topic. That's a great skill with anybody, even individuals without autism. Children with autism, I think it's more important to think about what is the child doing, or what's the purpose of what they're doing. So if a child is getting really stuck, or they're having sort of inability to move on, it might be one of those things where you answer if they are like asking a question, asking the same question over and over again. The idea is, all right, I'm going to answer this question once, and I'm not going to answer it again. And so it's like any behavior that you're trying to address that is more of, it's not necessarily defiance, but it's more of an annoying or sort of problematic behavior, but not extreme. The idea then is I'm going to be consistent with it. So I'm going to answer your question, and then I'm not going to answer it anymore. And then you can just go ahead and ignore it the rest of the time. Versus if that child really is stuck on something because they're having a hard time regulating, then again, maybe giving them a hug or removing them from the situation will help sort of reset them so that they can tackle the world again. These are great questions. Okay. Someone else said, what are the ways you differentiate between tantrums and meltdowns for parents? I think that's honestly teaching individuals the skills so that they understand and become very aware, almost think critically like you do. So thinking about what is it that happened before, and that might really help them understand in that moment what it is. So I think we're out of time, so I really appreciate everybody asking questions and attending today. And I'm not sure, I think Chad had that information that you needed on the PowerPoint there, so making sure that in order to get your CEUs, you email him and type in that code, and so that you can get everything that you need, including your first and last name. So sorry, Chad, about your audio not working, but I appreciate everyone for attending today, and if you do have any questions for me too, feel free to email me, and good luck with all your clients. Thank you, everybody.